time of the year that we call the flu season, where we see an increase in the incidence of respiratory infections in the community. This year, COVID-19 has dominated all the headlines, but let's not forget about the seasonal influenza. Every year, according to CDC estimates, influenza affects between 3 to 11% of the patient population. Last year alone, between October 2019 to April 2020, influenza caused between 24,000 to 62,000 deaths and around 410,000 hospitalizations in the US. This year especially, it is imperative that we try to prevent influenza to conserve the healthcare resources to take care of patients with COVID-19. Patients who are younger than 5 years old, elderly patients older than 65, patients with asthma, diabetes, and heart disease are at a higher risk for complications from influenza. These complications can range from moderate complications like sinus and ear infections to severe complications like pneumonia and even sepsis, which can cause hospitalizations and even deaths. It is also important to prevent influenza in healthcare workers and people who take care of or live with patients who are at a higher risk of complications from influenza. This year, masks, to an extent, will help prevent respiratory infections by acting as a physical barrier protecting the respiratory tract from outside viruses. Hand washing in various studies has been shown to prevent respiratory infections, and in one study, it protected to up to 45%. If you're sick, please stay at home to prevent spread of infections in our schools and workplaces. Smoking has a negative impact on our body's ability to fight respiratory infections by causing structural changes in our respiratory tract cells and also a reduced immune response to these viruses. Smoking cessation in various studies has been shown to reduce risk for complications from influenza. Now would be a great time to quit smoking. There are 4 vaccines that I'll be talking about to prevent respiratory infections. Influenza vaccine is recommended by the CDC for patients older than 6 months old. The high-dose influenza vaccine is recommended for elderly patients older than 65. There are 2 different pneumonia vaccines recommended by the CDC. Prevnar 13 is recommended as part of the 4-dose childhood vaccination series. It is also recommended for patients with impaired immunity, and as per the latest CDC guidelines, it is recommended for elderly patients older than 65 as part of a shared decision-making conversation with your physician. Pneumovax 23 is recommended for elderly patients older than 65 and for patients between 2 and 64 years old who have asthma, diabetes, and heart disease. It is also recommended for smokers. There are 4 different COVID vaccines in the US in phase 3 trials that are approaching the finish line. It will likely be several months before these are available for mass distribution for the general public. Patients with influenza are contagious starting around a day before the onset of symptoms to around 3 to 5 days after the symptoms start. Please see your physician and you'll be treated as per the CDC guidelines. This year especially, it'll be a challenge to differentiate between influenza and COVID-19 as they have similar symptoms. The rapid influenza tests are used to detect influenza A and B, and the rapid antigen tests and the nasopharyngeal PCR tests are used to detect SARS-CoV-2 virus that causes COVID-19. Antiviral medications given within 2 days of onset of symptoms help to reduce the severity and duration of influenza, especially in patients with higher risk for complications. At Columbiana Family Care Center, we offer same-day appointments and walk-in appointments for your convenience. We also offer telemedicine appointments for patients who are not able to come to the office. We also offer vaccines recommended by the CDC. At Columbiana Family Care Center, we take care of your entire family.